Hey, this is Dr. Firnhaber, and it's time for 10 Minutes of Truth because it's Wednesday. And so today we're going to be talking about the information in an article from the British Journal of Sports Medicine in February of this year, February 2023. So this is a fairly recent article, very important article as far as I'm concerned. The name of the article is Effectiveness of Physical Activity Interventions for Improving Depression, Anxiety, and Distress. An overview of systematic reviews. The object was to synthesize all the evidence on the effects of physical activity on the symptoms of depression, anxiety, and psychological stress. They looked at over 1,000 randomized clinical trials, and these trials had very, very high levels of evidence. The age was 29 to 86, and when we talk about physical activity, the average amount of physical activity was 150 minutes per week. So let's do a little background on stress and anxiety and depression. So mental health disorders are among the leading causes of global health disease and one of the leading causes of disability in the world. The annual cost in the world is $2.5 trillion, and that's going to increase to $6 trillion by 2030, which is only like 6 years away. In the U.S., the recommended guidelines for treating depression and anxiety, there's two. There's psychotherapy, which is counseling therapy, and then there's pharmaceutical therapy, which is antidepressant, anti-anxiety medications. And those are the two primary recommended guidelines. Lifestyle approaches are considered alternative care, and they're not used at all, really, until these two things don't work. So a lifestyle is not really looked at too much until the other two aren't working. There's literally hundreds of studies examining the effects of physical activity on depression, anxiety, and psychological stress. Physical activity has similar effects with numerous advantages over psychotherapy and drugs, such as cost, side effects, and other health benefits, such as weight loss, increase in muscle mass, things of that nature, lowering of blood pressure, lowering of pulse rate. There's so many effects that physical exercise has on the body. Improvements were observed across all clinical populations in people who exercised for depression and anxiety rather than taking pharmaceuticals or going through psychotherapy. What they found out was this: high intensity exercise showed improvements in depression and anxiety. So what's high intensity exercise? So when you do something very intensely till you basically, you're too tired to do it anymore. So sprinting for a ways, doing some weightlifting until you can't lift, until you just get too tired, you have to rest. That's high intensity exercise. Resistance exercises, this is push-ups, pull-ups, dips, weights, using weights, was better, had really good effects on depression. Yoga and other mind-body exercises were very good for reducing anxiety. Now, while the effects of exercise for depression and anxiety has been recognized, it's been recognized for a long time. These studies, these over 1,000 studies, that's many years worth of studies, and it's recognized that it works. However, it's often overlooked in the management of the conditions for anxiety and depression. So that's interesting because we talk about science. We talk about the need for science. You know, we want to look to the science. The science has showed for a long time that depression and anxiety is significantly helped by physical exercise, yet it's rarely prescribed. Now, the pharmaceutical companies love that. I mean, they would much rather see somebody take their drugs than exercise or go to a psychotherapist. But these studies have shown over a period of time the efficacy for physical exercise. Now, in this little box here that looks like the state of Nebraska, it says reductions in depression and anxiety are comparable or even greater than the effects observed by psychotherapy and pharmacotherapy. That was one of the defining statements in this study. So how does this work? How does this work in the body? What is the biological mechanism going on? Well, increased availability of serotonin, okay, which is the feel-good drug, norepinephrine, regulation of the hypothalamic pituitary adrenal axis, which is the stress, hormonal stress axis in the body. So it modulates this. The adrenal glands are stress glands. And when we're really stressed out, the adrenal glands start pumping out cortisol. We end up gaining weight. It does a number on our brains. It's very, very bad for brain function, cortisol. And it isn't good to be under stress for a long time because of what happens with the adrenal glands. The adrenal glands also produce a lot of our sex hormones. So when the adrenal glands get tired over time, you know, our backup system for things like testosterone, estrogen, and progesterone, that system starts to go down. So exercise helps the hypothalamic pituitary or HPA axis. It also lowers systemic inflammation. We know the studies have shown, many studies have shown, that there is a direct correlation between systemic inflammation in the body and depression because it causes inflammation in the brain. So exercise decreases systemic inflammation. Now, I can tell you from my own life, and I've been a really avid, almost, I would say, almost fanatical exerciser since the age of 25. And I can tell you without question that high intensity interval training and resistance training are very, very effective in maintaining good brain balance, good emotional balance. There's times when I've woken up and I just having a bad day. I was depressed and unhappy, and I'd go out and exercise, which is just part of my life. And by the time I was done, depression, anxiety, gone. And I was ready to get on with my day. And that's happened to me many, many times. And so I think it could be beneficial for all of you out there as well. This is so much better and so much cheaper than taking pharmaceuticals. And there's no side effects with exercise except greater muscle mass, lower weight, and just a healthier digestive and immune system. So I would recommend exercise to anybody who's able to do it. And most everybody can do some form of exercise. But if you're on these pharmaceuticals, if you have to take drugs for anxiety and depression, or if you're seeing, a counselor for something, and I'm certainly not against counseling at all, not even a little bit. But, you might find that you get better, faster, and more efficiently by adding a good exercise program into your routine. And once that becomes part of your life, you may not even need those pharmaceuticals or counseling sessions anymore. So that's all I have for today. Today, Wednesday. Next Tuesday evening at 6:30, we're doing a talk in my office called Natural healthcare for animals. And I'll be talking about how you can use natural healthcare to keep your animals healthier, disease-free for a much longer period of time. And I'll be demonstrating how I adjust dogs. So some people are going to bring their dogs. I'm going to go ahead and adjust them and show you how I adjust animals. So that's in my office. It's always free. Next Tuesday, a week from today, or a week from yesterday, at 6:30. So I'll see you then. Come by and learn.